So for Indians, it's very usual or casual to live and think like thoda pain, thoda dard to sabko hota hai, and nobody even bothers till it becomes too bad. And for a country where people are running 3 jobs to even make a livelihood, especially I'm from Mumbai, where this is common. So it's very usual for people to ignore their basic things, including pain. And it's like somebody's cooking their disease in a pressure cooker, and till the CT comes, nobody even bats an eyelid. And once the CT comes, it's already too late. So people start ignoring pain. I've seen people having knee pain, and then pain, then more pain. After a while, they go to a doctor, and then he suggests, okay, now replacement. It is still not ready. So they wait till it becomes ready for replacement. So it's that situation. So pain per se was meant to be a protective mechanism so that we can prevent our body from damage. But what happens is, if that pain becomes chronic, now the same pain protects us from working. So it prevents us actually from doing our normal routine activities. And some of my patients who come to me, they can't even lift a coffee mug. So they have so much of pain and they can't do their daily activities, and it hinders their career, their lifestyle, their income, their relationships, everything. So I have had people who are going for separation because the other partner is having chronic pain. So you'll be very surprised to hear about this. And as a result, pain affects all of us in a very negative manner. Plus, just think of it, you are doing any activity and you start having pain, like exercise also. So you won't be able to do that activity, and it can become very daunting. So it starts affecting all of us. It's kind of a fire alarm which rings all the time in your brain and kind of stops you from doing any activity. So lifestyle and sleep play a very important part in pain, especially chronic pain. So when I say I treat pain, it's mostly the chronic pain. And chronic pain development has got a very complex mechanism. But if you see sleep per se, it plays a very important role in the patient's recovery. So all of us, when we sleep, our brain kind of recovers, our body recovers, the chemical milieu of the body changes, and it comes back to normal. In people whose sleep is disturbed because of whatever reasons, this does not happen. So brain is tired, you are tired, because the chemical mediators are still there, it's not been cleared properly. And as a result, it's a very fertile ground for chronic conditions like pain to set in. And not only pain, it's the same physiology for allergies, for autoimmune conditions. So sleep plays a really important role. So if the pain is ignored, it becomes worse and worse. Just try to think in the way that the brain is sensing the nerve signals through this complex and intricate network of nerves, and it senses all this through these sensations. Like for example, there's a pinprick here, the nerve sensation will go from here to my spinal cord in the neck, and then it will be relayed to the midbrain and then up to the higher centers. Now what happens is, if I start having pain in one spot and it becomes chronic, after a while, my brain will start to think, yeah, constantly this pain is there from this part, so this finger is always going to have pain. So in some patients, what can happen is that even if you treat that pain, that brain will still keep on thinking that pain is still there. And as a result, it will be kind of a sensitization of that portion. So it's very important to treat it early, because the later part, when the central sensitization has happened already, it's very difficult to reverse it, because then we need to utilize the strategies which can overcome that. So we have some strategies, but then the success ratio is poorer in those situations. So I strongly recommend that the earlier you come, the better it is, and also it prevents the patient from losing out on his mobility, and less disability is there in earlier stages. So pain physicians are a special breed of doctors. So they are super specialists So you have to do an MD or DNB in anesthesiology, and after that you can super specialize in pain. World over, most of the pain physicians are anesthesiologists, and this was initially so because the initial treatments were focused on blocking the nerve impulses. But now, in the last over more than 5 decades of pain practice, the pain physicians have been focused on various other advanced treatments like radiofrequency ablation, like regenerative medicine treatment, where they are treating the cause itself, and spine endoscopy, neuromodulation. So there are a lot of different fields which have come up, technologies which have come up, and hence it is a kind of a drug-free treatment which we can provide with minimum side effects and quick results. So I come across mostly musculoskeletal pain, pain due to neurological conditions, and pain due to cancer. So for the musculoskeletal pain, I see patients who are suffering from back pain, neck pain, knee pain, shoulder pains, wrist pains, and conditions like plantar fasciitis, tennis elbow, etc. And these conditions are because of the faulty lifestyle or injuries or repetitive strain injuries or overuse of these structures, and they can be treated very well by technologies like radiofrequency ablation, where we numb the nerves, then regenerative treatments like platelet-rich plasma, bone marrow aspirate concentrate, and also with the conditions with the solutions like spine endoscopy, wherein we are going to endoscopically remove the structures which are causing the issues to the nerves. And last but not the least, neuromodulation, where we are going to actually modulate the way in which the nerves send these signals to the brain. So there are various ways in which we can treat, and these are some of the possible solutions. In conditions like cancer pain, you'll be surprised to know that the treatment of cancer itself causes pain. Like if you do a cancer surgery, causes pain even after healing, and people are putting hashtags cancer free, and after that still they have the pain. And in addition to that, the chemo causes pain, peripheral neuropathy, which is very big side effect of chemo, and then also radiation therapy also causes pain. So a combination of these causes pain. So even if the patient becomes cancer free, still they have the pain, which we treat. And in addition, if they don't become cancer free, again they have to live with the pain. So again that has to be treated by us. And lastly, the neurological conditions, for example trigeminal neuralgia, which is suicide disease, or other neurological conditions. So we can actually treat them as well by modulating the nerve signals and giving relief to these patients without the use of the medications. So earlier referral allows us to intervene so that the disease does not progress to a late stage. For example, somebody has a back pain and there is a very slight disc bulge. They go to, say for example, a physical therapist, and they are not treated, they are not happy. So the therapist tries their best, but then the pain is still there. Then they go to a surgeon who is trained in doing surgeries, but then he sees the MRI and the MRI is not so bad that it requires a surgery. So he gives some medication and patient comes back and tries to manage that. But when we see that, we may be able to kind of do a procedure like, for example, a disc annuloplasty, to make sure that that disc never ruptures. You may be able to identify an early facet joint arthritis, so that we can actually treat that one particular joint and the patient's pain goes away, and he can exercise and prevent the spreading of the disease to other joints. Okay, and as a result we can actually prevent the disease from progressing. Another example is knee arthritis. Nobody has knee pain as bad to require a replacement on the day one, so they start with a knee pain, right? And then slowly they start progressing, and one time comes when they go to a doctor and he says, oh yeah, your x-ray is not so bad, so we may consider replacement after 5 years. So what does that patient do during those 5 years? So they go to various places and try all sorts of treatment. So the knowledge is not there. But if they come to us, we can do a regenerative procedure for them. We can prevent that disease from progressing, treat the very much basis of that disease, and may be able to stop or at least slow down the progression of the disease, and in some cases even reverse it. So that's the advantage. So India is at the forefront of pain management. So per se, if you see the pain management, this branch has come from the United States of America, and where the father of the modern pain medicine, that is John BOHECO, used to live. And he was a anesthesiologist, and he was in the Vietnam War, and he was, doing the all the pain management for the soldiers there. And after that, when he came back to US, and he started and modified his techniques to help the patients. And very interestingly, now this has evolved into a full-fledged branch. And in 1970s, he opened more than 200 clinics across the US. And now we are in 2025, and probably more than 55 years afterwards, we are still trying to create awareness about pain during the Pain Awareness Month. So you can understand where we are standing here today. And although in many countries it was late to start, but India, knowing our immense medical talent, we have adopted very fast. And we have given, in fact, MIPSI is an Indian solution which we have given. Spine endoscopy, we are doing much better than most of the other pain physicians across the world. And as a result, we are one of the forerunners in these technologies for the world. So this Vijaya, it's got a very good role, because it is any which ways, there has been no new painkiller which has been invented in the last many decades. And this gives us one more molecule or one more treatment strategy which we can use to help our pain patients. And it's a very unique, you can say, strategy, wherein not only we are taking care of the sleep, we are taking care of the pain, but also the patient feels a little elevated and happy. And as a result, here overall mood and health and quality of life gives a good amount of improvement. And to add to it, it's not very expensive as well. So this is quite interesting and very useful arrow in our quiver, which we often fire when we have to deal with certain kind of situations.